We'll move to a couple information items, starting with the superintendent's update. Dr. Swift.
Thank you, President Johnson and members of the board and the community. We appreciate the opportunity to update this evening on our work. We recognize that this COVID time continues to be challenging, in fact, impossibly challenging. And this week, we've been giving a lot of thought, not only to our students and the educators who've worked so hard, but this week thinking a lot about our parents, and particularly working parents who have the realities, pretty brutal realities that we hear about from our parents every day. And we're all familiar with that saying that a child's first teacher is the parent. And yet we recognize that during this COVID school year that phrase has been taken to an entirely higher level, as no parents, I believe, have ever had the kind of ongoing challenges that they've experienced this year. The classroom has become the kitchen table. Parents have had to navigate technology and be on the phone with help desk, learning about learning platforms and serving as the student support and the teacher support, the encourager, and so many other tasks during the day, alongside all the normal roles of parenting. So I know that those parent challenges, I just want our parents and our community to understand that we recognize those challenges. And I want you to see that we recognize those challenges. We will continue to work to improve both our virtual delivery for those students and parents who will remain in that virtual delivery. And we are also working to continue our wraparound supports, as well as to respect and support our parents who will choose to return to an in-school hybrid learning option when that time comes. This has been the intent of our work every day. And I recognize that sometimes our parents don't hear enough how much we are grateful for their partnership. And certainly this year, we would not have been able to deliver education during this COVID pandemic without the partnership and support of our parents. We've come a long way. 11 months. We've just passed 11 months since the governor ordered. Our Ann Arbor Public Schools declaration came a few hours ahead of the governor, and it has just passed 11 months. We recognize the significant need to have our students back to in-school learning. I want to thank our students and our staff, our parents, and our community for their hard work, and we are looking forward to the day when we can welcome our students back to in-school learning. As we shared on January 13th, we've set our direction toward a transition to offer an in-school hybrid learning option for all our students and families who choose this option. We have been preparing since last summer, and we are putting the final touches on those plans, working diligently for our students and staff to again be learning in their natural setting inside our Ann Arbor Public Schools buildings. And yet we need to see still the rate of COVID infection reduced in order to achieve a healthy and safe and sustainable return to in-school learning. We know that the discussions across the community vary widely on the topic of return to in-school learning, and we hear and understand that the needs, the preferences, and the family situations fall along a wide continuum when it comes to COVID and the return to school. Fred Klein was correct. We're in many meetings over long days, every day, putting those details in place so that when the time comes, we will be ready. We do have a primary responsibility to maintain the health and safety of our students, of our staff, and our community. So we continue to monitor the situation. When we can safely return, just a reminder of stage 1 includes pre-kindergarten, Y5, and kinder students who choose a hybrid in-school learning model. Students with high-level specialized learning needs, self-contained classrooms at all levels, and small groups of middle and high school students most in need of learning support. Following that, a week later, first and second grade students, and following that, a week later, grades 3 through 5. As we have shared, the transition to in-school learning timelines depends on 3 key issues. We've heard from several folks in public commentary this evening, so I want to draw attention to the 3 critical key components that we are monitoring for this portion of our decision process. First is the progress of COVID vaccination rates for our school team members. I believe the trustees will have more to share about this evening, and I do understand that there are those in the community who believe that vaccines are not necessary for a successful return. I do understand that that was a part of the CDC report, but yet that is an important part of what we are monitoring. Now that the vaccines are here, it is much better if we open with our teachers and staff having had the opportunity for a vaccine. Secondly, we monitor ongoing levels of school and district COVID infections and community spread. We have seen, and we're delighted to see it, about a 16 or 17-day decline in the rate of, in the number of cases, COVID cases. That is an encouraging sign, and yet we remain right on that cusp of level D, level E, the highest level. The third area that we are watching are emergent issues that could impact a healthy and safe return. One of those emergent issues, I think everyone's familiar with it now, is that emergent issue of the COVID variant. The COVID variant predicted or analyzed to be somewhere around 50% more contagious is a concern. Our Michigan top doc, Dr. Khaldun, continues to advise on this, and at this time, Ann Arbor, at this time, has the highest number of identified cases other than in an incarcerated setting in the state. So this is a real concern that we continue to monitor for. I want to touch on teacher vaccinations because I know there is some misunderstanding in the community that perhaps the district is not doing, or the superintendent is not doing everything that can be done, or the trustees as well, in support of teacher vaccinations. We continue to advocate at the local, at the state, and at the federal level for additional vaccine supply. We work every day in partnership with Washtenaw County Health Department. Members of our team are in touch with them regularly. Superintendents are in meetings with them also regularly. Our latest update from Representative Dingle really points to the root of the issue with vaccines is the supply. And I know she was working just a week ago when we met with her. She was working with Biden's COVID czar directly around how we can solve this vaccine supply issue. I do want to share a direct quote from Dr. Leanna Nguyen regarding the vaccination for teachers. She, in this quote was commenting on the CDC not requiring the vaccines for teachers. Of course, our board, our trustees have been clear, as have our administrative recommendations, that we will not compromise health and safety of our teachers, and that vaccination of teachers and staff is an important foundational component of being able to set a date and move forward with our reopening plan. Dr. Leanna Nguyen says it this way: the lack of focus on teacher vaccination points to a broader problem. The reopening guidance does not prioritize the health of those who work in schools. Growing evidence suggests that schools don't contribute substantially to community transmission, but that doesn't mean that they don't pose individual risks to teachers and staff. And while it might be that a student is safer in school than in an unmonitored childcare setting, it defies common sense to say that a teacher, especially one who may be older or has underlying medical conditions, is just as safe in a packed classroom as they are doing remote instruction. I just wanted to share more by using that quote from Dr. Nguyen about the priority of vaccinations and pointing to the three areas: level of community spread of COVID infections, progress of the vaccination effort, and other emergent situations. We are continuing to move forward, trustees, as you're aware, with a tremendous amount of work, and we are moving next in our process to our school community information sessions for elementary parents. It is critical that our parents have an opportunity to understand their two options: the option for hybrid in school and the option to remain virtual. We've talked about this year as a setting on the dial, and we're preparing to turn that setting on the dial to add the in-school hybrid option. And yet this is a family decision. So last week we offered 2 community information sessions, and this coming week our schools will begin their information sessions. Our principals will be hosting. For elementary parents, we look forward for those sessions and for the very straightforward survey that will come out in multiple languages, as is our habit, so that our parents can respond. Each elementary school will host to ensure that parents have the information they need right in their local school community. Those will be fully virtual sessions that can be either watched live or watched on demand, because we know our parents have many demands as they're trying to work and support their children. So there will be many opportunities for our parents to view those on demand following the actual timing of the sessions. We have committed, as we've committed from the beginning of the year, we will continue to offer a full virtual learning experience, even as we move forward to offer the hybrid in-school opportunity. I want to point to our health and safety. We will be using the mitigation strategies. Trustees, you've seen them in public presentation several times. The Super 6 will be working with those so that our parents, we've already been through multiple training sessions with our staff. We want everyone to understand exactly where we are with our processes and procedures for in-school COVID-informed health and safety. I'm asking Ms. Osinski to put up for us the Mdhhs report numbers from Monday. We report those every week to the board. This is the statewide indicator of how we're doing in our public schools with the infection rates in schools. So these are the infections that were reported over the previous week. 87 staff and students infected in 17 new K-12 school districts and 3 colleges, 566 staff and students in 93 ongoing school outbreaks, and the total for public school transmission cases, more than 8,000 now. These numbers only reference those cases that are determined on contact tracing to have been transmitted inside the school environment. So you can see there where we stand today. Thank you. I want to turn last, trustees, to our thinking around fall of 2021. We've heard from our parents and community members very much that they would like to know more about fall of 2021. We absolutely look forward from this COVID winter to spring, and hopeful that we can add the in-school hybrid learning opportunity. Our team is preparing to bring forward, as we normally do, in the 1st of March, a summer learning opportunity. Ann Arbor Public Schools was one of very few districts in Southeast Michigan last year to offer a full, robust summer learning program. We enrolled more than 5,000 students last summer, approximately a third of our enrollment. And we are looking at an even bigger program offering this coming summer. We are also looking ahead to fall 2021, and we know that February is the time when our parents and our staff and all of our community begin to think about the year ahead, the school year ahead. While we know that COVID will still be with us, we are looking forward to spring and to summer and to a strong delivery and a strong launch in fall of 2021. I'm quoting now from a recent New York Times piece by Emily Oster, and I will link this in my next superintendent update to parents so that you all have this link, although I imagine many of our parents are familiar with this. A recent piece on looking ahead to fall of 2021. I'll be brief, trustees, but I think this is important information. She says it this way: the pandemic has surprised us again and again, but given where we stand now, by the fall, a large share of adults will probably be vaccinated, and certainly all teachers and school staff members should have access to vaccines. Even with the new variants of the coronavirus spreading, high vaccination rates are likely to have driven COVID-19 rates down, hopefully very far down. However, children, especially those under 12, are very unlikely to have been immunized by the fall. And we shouldn't expect to see COVID-19 rates of 0 fall or maybe ever. Unvaccinated children in the presence of some COVID-19 should not prevent schools from reopening somewhat normally. The data does not support the need to wait for children to be vaccinated in order to return to school. We are feeling optimistic about a strong summer 2021 program, and we will be debuting more of those plans soon. And we are also planning now for a strong start to fall 2021. We look forward, so forward, to a robust time of a return to school this spring and summer and fall. And we know that our work now will set a strong foundation for a solid start to fall 2021. So in the AAPS, we have set our course for return to an in-school hybrid learning option this spring, beginning with those students with the greatest needs and with the youngest students. The success of this will move us through to the next stage of summer and fall. We have experienced a setback with a slower than anticipated rollout of vaccines for our school personnel. We will continue to monitor the data each week and will update the board and our community accordingly. As we've shared since last August, our steps are 3, and they're very simple and straightforward. This has not changed for many, many months. We will signal the board and the community that we've reached a level of COVID infection where it is safe to reopen. We will bring forward a proposal to the Board of Trustees, and in that proposal, we'll confirm a date for a partial or full reopening of school. Once we bring that forward to the board, we will communicate with our parents, with our staff, with our community, a confirmed date. Though right now, today, on February 17th, we're not yet out of this global pandemic, we are confident that together we will come through this challenging time. We do hear the urgency of the need, and we also hear and understand the urgency of health and safety. We will shift our focus this spring, summer, and fall on our work to restore, to renew, to recover as a district for our students and for our community. I understand that many in our community are dissatisfied and that many in our community fall along a wide spectrum of need and preferences. We will work together to move our students, staff, families, and parents beyond this current COVID time. So I hope that that update was helpful. I know that it does not contain the one detail that many folks are seeking, and that is an exact date. And trustees, in my responsibility to the safety of staff and students and community, I'm not able to bring that recommendation this evening. We continue to monitor the situation day and night, and I truly look forward to the day when I can bring that as our recommendation. And that concludes my superintendent's update, and I thank you for your patience.